Good morning, everyone. Today we are going to talk about cryptosporidiosis, which is caused by Cryptosporidium. Just a small introduction about this parasite. The first case of human Cryptosporidium or Cryptosporidiosis uh, sporidiosis. Okay, so the first case is was recognized in 1976. Uh, Basically, it came into light after the people who were having AIDS, acquired immunodeficiency syndrome. Uh, they presented with this condition or with this organism. But after that, there was a massive outbreak of waterborne cryptosporidial infections in 1993. So then you can say it came into too much light. So, just to tell you as the introduction that cryptosporidiosis is the name of the condition which is caused by uh, cryptosporidium. Okay. Now, uh, now cryptosporidium. What is the importance of this thing? Like, or why we are studying this thing? Simply, cryptosporidium. Okay, they have around 10 species. Okay, they have around 10 species. And this group of the organisms, uh, they are from a phylum or from a family of Plasmodium species. Now, they live in the intestines, right? Or it is an intestinal pathogen. Uh, the important thing about this thing is what? That uh, one of the condition or one of the organism which we are going to study in detail or the cryptosporidium species which out of these 10 species which we are going to talk mostly will be cryptosporidium parvum, right? uh, Now, because this one is the one which is mostly associated with human disease. Okay. So Cryptosporidium parvum, right? So this is the one which is mostly associated with the human disease. But like there are many other species which will come into the books, or you will found in your what you can say internal medicine books. For example, Cryptosporidium hominis is also there. Okay, or Cryptosporidium. Um, uh, there are many others as well. Which can be found in the books. Okay, but mostly Cryptosporidium parvum and Cryptosporidium hominis you are going to find in the books. Uh, Basically, previously this Cryptosporidium hominis was also called as Cryptoparvum genotype 1. Okay, and this one was called as Cryptosporidium parvum genotype 2. Okay, but then they name it like they name it as they changed the name it to Cryptosporidium hominis. What happens is like most of the time, as I told you, that the condition or this organism came into light in the patients of acquired immunodeficiency syndrome or AIDS. So remember this thing that most of the time you will found these infections in the people who are immunocompromised or immunodeficient, like the patients of AIDS. Okay, so this is the thing. Now, to tell about or to talk up more about the organism, uh, how it is presented and what are the features of this condition. uh, you can see this one. So these are the oocysts, okay, or oocysts of Cryptosporidium parvum. The A1 is like thick walled and this one is thin walled. So as you can see that this one is like you can say round to oval in shape. And now the thing is uh, mostly the wall of this oocyst is thick, but it also exists, like less commonly, it also exists in the thin walled form as well. Okay, one very important thing is, guys, like this is the one which causes infection in the humans, right? So this oocyst can remain alive or can survive in for a very long period of time. Uh, they can survive up to the temperature of 60 degrees centigrade. It can survive chlorinated water. Okay, so uh, that's the reason, like when if we have to kill it, we have to uh, increase or boil the water. You can say, if we'll talk about water, you have to boil it well above 60 degrees centigrade for some time to kill this one. Now the important thing about this one is why we are studying this thing, right? Like or what's the importance of this thing? Again, uh, this one have a wide geographic distribution, wide geographic distribution, like wide worldwide at present. Okay, but most of the time, the infections are more common in what you can say, more common infections in, I will write, poor sanitary conditions, like, or you can say like the developing world where the sanitations are not good, sanitation system is not good, so the infection is more over there. And infections are more common during warm, rainy months. Okay, so simply, like nowadays, there are too much rains and the weather is warm, so like this is the time when the infections are more, or you can say in the, like, before the winter when there is too much rains. Okay, so now as I told you that it mostly affect the people who are immunodeficient. So remember, like, the infections depends on what is the immune status of the patient, what is the age of the patient, either there is any local outbreak and all these things. So now uh, what you can say, uh, that in moist environment, as I told you, uh, see, moist because it's rainy. Okay, so of course when it's rain, so it's moist. So cryptosporidium, okay, they can survive for up to 6 months, and they can remain infectious. And the infection dose can be very low, like you can say around 10 oocysts are enough to cause infection. Okay, so that's the reason, like, uh, whenever anyone is exposed with, like, even like with 10 oocysts, they may have infection. Okay, but sometimes, like, the people who are already exposed or who already got condition cryptosporidiosis, they want a high inoculum. A high inoculum means what? Like, they need more of the oocyst, to get infected. So though this one is like these oocysts, they also found in surface of you can say uh, pure water source surfaces. So but, like, the spring waters, or you can say the running water, they are quite safe, because of course they are running, so like they wash them off. So but you can say if there is any sewage or any area where the sanitation is not good, of course, like oocysts can stay there, can survive there. So now important thing is what that like of course nowadays like the countries where the sanitation is good, sometimes they provide the water by recycling, so of course they treat it through multiple process. Okay, so they of course like they treat for all these things uh, nowadays, of course. Okay, so now uh, this oozes can also survive in seawater. Okay, and also what they found, like the shellfish which is found in coastal areas, they also found them infected with this oocyst. Okay, so that's the reason you can say like we can acquire the oocyst from consuming shellfish. We can acquire the oocyst by uh, consuming the contaminated water, or sometimes, for example, someone who is going for recreational purposes like swimming, like on in the beaches, and they are doing recreational activities. Of course, like some of the times the water go into the mouth, so in that case they may have this thing as well. So like this disease or cryptosporidiosis is also described in returning travelers, like persons who come in, and also the persons who come in contact with animals, like farmers, or the persons who are working in daycare uh, centers. And person to person contacts, or you can say transmission, is also noticed in many instances. For example, you can say simply fecal oral route transmission is also very, very, very common, or bisexual activities as well. So now, what you can say like and also they can also be transmitted through food sources, though that transmission method is not so significant, because simply the chances are less, right? So this is what you can say, uh, what I want to talk about the oocyst, or what I wanted to talk about the cryptosporidium. Okay, so let's go into the life cycle now. The life cycle, you can see like uh, the life cycle is quite simple if we will take in like the life cycle in man. Okay, so but you can see over here the infective stage, which is the oocyst, right? And the diagnostic stage is also the oocyst, right? So now the cryptosporidium life cycle can be completed in just one host, or you can say like they uh, don't need a secondary host, like like plasmodium. It needs mosquitoes. So simply uh, anyone who will ingest our oocyst. Now I already talked about how we can ingest the oocyst by recreational things, by drinking water, by coming in with contaminated water. So anyone who is going to ingest the oocyst, once it will reach the upper GIT tract, the organism is going to release a lot of sporozytes. And as I told you, that cryptosporidium, uh, remember like plasmodium. So plasmodium and cryptosporidium, they are very close together. So that's why you will see that they have this asexual life cycle as well. So simply a lot of the oocysts release a lot of sporozytes, right? The sporozytes bind, you can see like these are the intestinal epithelial cells. So these sporozoites, they bind to the intestinal epithelial cells by or via induction of actin polymerization. Okay. So now they provoke their own engulfment, and they reside in uh, this vacuoles, you can say, or parasitic vacuoles within the microvilli. See, these are the microvilli of the intestines, right? They are showing, and see what they are showing like this sporozoite is staying in this parasite vacuole or parasitophorus vacuole within the microvilli. Okay, now the parasites now goes asexual reproduction. We call it as merogony. Okay, like so the this is the asexual reproduction. Okay, It is called as what? Mirogony, and that's why it is called as miront, right? So this is termed as mirogony. This asexual reproduction is called as mirogony. So ultimately, what they produce is merozyte. So remember, like, see, this is type 1 miront, this is merozyte. So trophozytes, oocysts release sporozytes, sporozytes change into trophozytes, and trophozyte goes into mirogony cycle or asexual reproduction, and they will produce what? They will produce merozoites. Now, uh, this merozytes, they are released. Okay, so this is the type 1 miront and this is the type 2 miront, and simply this type 2 miront will be released in the intestine. Okay, you can see like this one is released. So they are simply merozytes will be released uh, uh, from the intestines, okay, or from the lumen. Okay, and then they again will to bind, and again they will be engulfed by the epithelial cell, you can see over here. Okay, so see, they are incorporated and then they went to asexual reproduction and then they are released, and then they, like the merozytes, they are binding with the epithelial cells again. Okay, now this merozytes will go into sexual reproduction this time, right? This one is asexual mirogony, and this one they are going to enter into the sexual reproduction, right? So now what will happen, this engulfed merozytes, they undergo sexual differentiation. Okay, so they will form, or they will ultimately fertilize, and see, they are forming what, a microgamont and macrogamont. Micro is small one and macro is big one. So ultimately there will be fertilization of this macro gonads by microgonads, and they are going to form a new oocyst. Okay, you can see like once they are, these microgametes are released and they will fertilize and they are going to form a zygote. So now these new oocyst or zygote may either will be shed into the environment, or they can come into the, like, or they will be accessed. Access means what? Like they are coming out of their cyst into the same host. You can see like here, sexual differentiation into macrogamont and microgamont, and they fertilize together, they form a zygote. And you can see over here, uh, this one, thick walled oocyst, it can exist the host by the form or by feces, and this thin walled oocyst can release again one more oocyst, which will again start this cycle. So I think it's very, very, very easy, because see, the oocysts will be released, sporozoites are formed, trophozoites enter mirogony, release merozytes, merozoites again engulf the intestines, will go into sexual reproduction, form a zygote, and zygote have two fates. One, it will be released in the same host, or it will exit the host and infect others. So now the important thing is like this uh, organism can be found throughout the GIT tract. However, it appears to have an affinity, or more like they like to stay more in jejunum. Okay, they like to stay more in jejunum than in ileum and then in proximal colon. Though they can be found anywhere, but like these are the areas they mostly engulf, right? Now, uh, what happens, like sometimes you can say the biliary tract, or the cells of the biliary tract are called as cholangiocytes, and that's why it is called as cholangitis. So cholangiocytes are also susceptible to this infection. Okay, so they can also cause biliary disease. The respiratory tract also appear to be a site of infection. Okay, but in immunocompromised individuals only. Okay, so Basically whatever happens, whenever it is going to affect either the respiratory tract or the biliary tract or the intestine, it can cause cell death or apoptotic cell death or necrosis. Okay, so epithelial cell death can occur in any involved region. So now, this is how this organism it engulfs and it completes its life cycle. The thing is, like, what happens that whenever the epithelial cells get infected, there is dysregulation of the cell signaling pathway, and there is upregulation of pro-inflammatory cascades like cyclooxygenase 2, prostaglandins, all these things. So what happened due to this, like the epithelial cells, they get damaged, they become dysfunctional, there is increased intestinal permeability, there is a decreased or you can say abnormal electrolyte absorption, abnormal secretion of fluid, there can be malabsorption, and that's how the intestines mainly can get affected and the person will present with sign and symptoms. So what is going on? Simply there could be they can damage the epithelial cells, they can damage this barrier. Okay, they can damage the permeability of the intestines, they can cause problem in electrolyte absorption, they can cause problem in secretion or fluid absorption, or simply they can cause malabsorption. So these are the things which will lead to all the clinical features. So talking about the clinical features about or for this condition, um, like how this condition presents is basically uh, the most common presentation you can say or clinical presentation for cryptosporidium or cryptosporidiosis, the people who get cryptosporidium or get infected by cryptosporidium, they get a disease called as cryptosporidiosis. Okay, so the main thing is non-bloody diarrhea. So non-bloody diarrhea is the most common you can say clinical feature. Okay. Okay, but the clinical features or findings, they are not like just diarrhea, like they can be different depending on the host. Okay, for example, like whenever they have diarrhea, the duration of the diarrhea is quite variable. Like the incubation period of this condition, like this is like around incubation is 7 to 10 days. Okay, uh, but sometime, for example, uh, but sometimes you can say like uh, it can range from several days to several weeks. Okay, so now what happens is whenever the patients are immunocompromised, right? So, or you can say in immunocompromised. So, who are the people who are immunocompromised? As I told you, one thing is AIDS, right? But remember, like too old people, like the people of like who are too old, they are immunocompromised. The people who have cancers or chronic diseases, or the people who are getting treatment for cancers, all the patients who are using steroids, all the people who have transplantations done, so they are all immunocompromised people. So whenever a patient is immunocompromised, the most common presentation they is watery diarrhea. Okay, in these patients. Okay, now the severity of this diarrhea can be variable, like ranging from a very small amount of stools to a very you can say watery stools, right? So, but the diarrhea is usually self-limited. So the diarrhea usually persists for 14 days. Okay, so uh, it usually persists for 14 days. It's not like this, like it always persists for 14 days. Maybe it could be for a month, right? It could be prolonged. Now with diarrhea, what the people have is basically the diarrhea comes with abdominal cramping pain. Okay. Also, sometimes the patients have fever, they may have malaise, okay, as well as they may present with nausea, nausea and vomiting, right? So all these things could be there. Other than that, depending on what area or what organs or what organ system this organism is affecting. For example, whenever they are going to affect the respiratory system, of course, the patient will be having respiratory disease. Okay, whenever like they are going to affect the biliary tract, the patient will be having biliary tract disease. But most of the time, there are extra intestinal symptoms. Extra intestinal symptom is what, like, remember, all the symptoms are due to the organism in the intestine. So extra intestinal features is like when the organism is giving some symptoms or signs which are other than the GIT tract or intestines. So they may present with headache, fatigue, uh, dizziness, okay, as well as eye pain or ocular pain, as well as arthralgias or joint pains. Okay, so but most of the time these extra intestinal features are seen with when the infection is with Cryptosporidium hominis, right? So mostly like this is the organism which give extra intestinal features. So uh, and when someone is infected with this Cryptosporidium, guys, remember that they do develop some immunity, and the infections in an already infected person is always less, or any, you can say a seropositive person get less symptoms. Okay, now this Cryptosporidium, you can say, like, in the developing world, the children, whenever they have this thing, the diarrhea is the most important clinical symptom. And That's the reason, like, whenever they have diarrhea due to this thing, again, remember, it can persist for 2 weeks. Okay, so, but like, but in developing world, due to this diarrhea, the children may die because of diarrhea. Okay, because of dehydration, they can die. So now, uh, uh, like, you can say, like, this condition have two major importances. One is simply, uh, you can say, in the normal people, and what will happen in the immunocompromised people. Okay, so when you will study HIV, uh, uh, human immunodeficiency virus, you are going to know a lot of details, like, because in HIV what we see is the immune status of the patient. For example, the patient, when their CD4 count cell is going down, or you can say less than 200 cells, they are more likely to get infection by this one. Okay, so whenever, like, we have a AIDS patient, of course, like, it's not the topic for you guys, but just to tell you, in the AIDS patient we keep on checking their CD4 count cell. So remember, like, any AIDS patient, when the CD4 count cells are is less, and whenever they have a diarrhea like condition, we always think of cryptosporidiosis, right? And or when they develop a biliary tract disease, for example, or lung condition, we always think about cryptosporidiosis, right? So that's the important thing, you must remember. So again, guys, I will go to the, uh, you can say, the investigations or the diagnosis, investigations, or you can say the diagnosis, how we diagnose this condition. So the diagnosis, now, the clinical features, right? So what will be the clinical features? You will see diarrhea, right? Especially in immunocompromised people. So first of all, remember about the clinical features in diagnosis. Okay, so remember about the clinical features of this condition, and then we can go for stool examination. So in stool examination, simply, uh, they can found the ova and the parasite. Okay, but routine stool examination for ova and parasites, most of the time they fail to detect the organism. Okay, but the clinicians, they must specify that we have to check them for Cryptosporidium species. Okay, so now what they do is like basically the sample, they preserve the sample in 10% buffered formalin solution. Okay, and then like they do the detection of this thing. Okay, so because whenever like uh, they are going to see a unfixed specimen, you can say like the higher chances of missing the diagnosis. So there are also very like a lot of other diagnostic, you can say, uh, I'm sorry, wait. There are also some other diagnostic, you can say, modalities which are available for this one. For example, um, mostly, microscopic examination or microscopic examination can detect the oocyst, right? Which is the infective as well as the diagnostic stage of this condition. So microscopically, they can found the oocyst, which are very small, and they use some standard staining techniques, including the acid fast staining. So whenever they use like acid fast staining, the oocyst there, it appear pink or red on a blue or blue green background. Okay, this is how they see. Okay, so now sporocytes can also be seen in the oocyst. You can, as you can see over here, right? So uh, that's how they diagnose this condition. Now, uh, the other test which we can do is like we can do some other investigations, or we can like we can use some special stainings we can use, to uh, catch this organism. So this thing, gamma staining, using staining techniques and hemotoxylin staining techniques, like there are different staining techniques which can be used, you can say. Okay. But nowadays, most of the time they use immunofluorescence assays. Okay. Nowadays, like they nowadays, they use more of these to make the diagnosis. Okay, because they are more sensitive in catching this condition. So ELISA can be performed, guys, antigen detection for antigen detection, or you can say nowadays they also have immuno uh, chromatographic kits, okay, to detect these things. And now many companies, they are making this immunochromatographic kits, and they have very good sensitivity, they have very good specificity. Okay, so these things can be used. um, PCR can be used, though it is not too much in practice, not widely used, but it can be used. Okay, in this one. So there are like different serological tests also which are available for the investigation. Okay, so simply what you can say, there is a lot of diagnostic methods you can see. Okay, which we can use in the diagnosis of Cryptosporidium. Uh, in especially the immunocompromised people who have biliary disease or pancreatitis. So, uh, like of course, like that gives a very strong impression that the patient may have Cryptosporidium. So even if the stool examination come back as normal, then we go for what you can say other testing techniques, right? So of course, like in that case, you will go for pancreatic testing, you will go for biliary tract test or liver function test or ultrasonographic abnormalities you will see, and or you can run all these tests in that patient. Management is a little different. What is the all the management which we used to discuss in the previous conditions? Like mostly we give albendazole and mebendazole, as you know, for different parasites. Of course, this one have a little different management. So, of course, like what kind of condition this Cryptosporidium gives? It gives diarrhea, right? So remember, treat the diarrhea. So how we treat the diarrhea? Basically treat the dehydration, you can say. Okay, so how you will treat the dehydration? Of course you have to give a lot of fluids, give fluids, okay, give electrolytes, of course, like, right? So that's the important thing, especially in kids. I told you, uh, uh, that's very important because they can die because of this thing. Take care of their nutrition, okay, especially give them lactose free diet, okay. Now because there is malabsorption also, because they destroy the intestinal villi, so the fluid absorption, if it is given orally, uh, fluid absorption can be increased by giving glutamine, okay, to these patients. So glutamine can be given to these patients, okay. Sometimes, we go for symptomatic treatment, like to stop diarrhea. We use anti-motility drugs like loperamide. Okay, it comes by the name of loperamide, Lomotil, in many of the countries. Okay, other management points, like, of course, until now we are just treating diarrhea. We are not treating any other thing or the organism itself. But I'm talking about the treatment of diarrhea. So Lomotil can be given. Okay, but if the disease is getting too severe, we can give opiates or octreotide as well. Of course, like if there is any obstruction uh, in the GIT or in the due to gallbladder disease, then treat that thing surgically. Now, the bad thing is, like the anti-parasitic therapy is not doesn't work so well, you can say, in these patients, or you can say it is very disappointing, especially in the patients who are immunocompromised, uh, especially in the patients who are malnourished. Okay, okay. So what things we can give to them is, there are certain drugs. I don't know how much you know about them. Is like parmomycin, which, like we discussed before as well, azithromycin, which is a macrolide, as well as nitro nitazo nitazo oxide oxalate nitazoxanide, right? So these are the drugs which we can give. So in immunocompetent individuals, especially, this one is the best one nowadays, which is used. Okay, uh, this is also available in syrup form for babies. Okay, or for children for pediatric use. So and now, guys, the important thing, especially in immunocompromised people, uh, is basically to improve the immune function. So basically, especially in the patients of AIDS, what we do, we have to put them on antiretroviral therapy to increase their immunity. So when they increase their immunity, of course, like they can clear the infection themselves, right? So like AIDS, AIDS, anyone who have AIDS, like this is the general treatment. We give them antiretroviral therapy to improve their immunity. Now, um, this is like how we treat the patients of AIDS, but like these are the medications which can be used, especially this drug, paromomycin. It has shown to improve diarrhea, especially in the patients who have AIDS. And when we give this drug in combination with azithromycin, okay, uh, this one is like also effective, like you can say double effective when they are combined together, okay, because they treat the diarrhea, they treat the symptoms, and they also shed a lot of oocytes in these patients. So in AIDS, especially, they can give them like a combination of drugs. They give the drugs like to improve their immunity. Okay. So uh, what you can say that there is like some other researchers or some other data available, like some combination of drugs like spiramycin, clarithromycin, drug like this. They can be also be combined together and can give, right, to these patients. However, of course, like in parasitology, the good thing right now is like you don't have to remember the name of these drugs. Okay, rather, you have to uh, pay more attention, how this parasite is like works in that patient. So now, uh, the last thing which we study for almost every condition is called as prevention. So guys, how we can prevent, of course, improve sanitation. Okay, you can say washing hands. Okay, also treating or starting antiretroviral therapy in AIDS patients, right? So this is how we can prevent, or we can decrease the effect of this condition. So thank you so much for listening, guys. That's all from for cryptosporidiosis or cryptosporidium parvum. Okay, rest like I'm going to see you in the next lecture. Thank you so much.